Have you ever had one of those moments in the kitchen where, in a split second, something goes wrong? Maybe you were cooking a nice dinner and your hand brushed against the side of a hot pan. Or perhaps you were making tea, and a little splash of boiling water landed on your skin. Maybe you were frying eggs and some hot oil decided to jump right out of the pan and say hello to your arm. If any of these sound familiar, you're definitely not alone. Minor burns are one of the most common household injuries, and they happen when we least expect them. In fact, according to health statistics, millions of people in the United States experience burns at home every year. The good news: most of them are minor and completely treatable at home if you know what to do. The bad news: if you don't treat them properly, even a small burn can become a much bigger problem, leading to pain, infection, and scars that last for years. That's why today's video is so important. We're going to talk about how to treat minor burns naturally, at home, with simple remedies you can easily find in your kitchen or garden. I'm going to share 5 effective natural treatments that can reduce pain, speed up healing, and lower your risk of infection, all without harsh chemicals or expensive products. Now, before we get into these remedies, there's something I absolutely have to stress. Not every burn can or should be treated at home. There's a big difference between a minor burn and a serious burn, and knowing the difference could save your life. A minor burn, what doctors call a first-degree burn, usually only affects the outer layer of your skin. It might be red, a little swollen, and tender to the touch. Think of a mild sunburn or a quick touch of something hot. Sometimes, minor burns can include small blisters that's edging toward a second-degree burn, which still might be treatable at home if it's very small and in a safe area. But then there are the serious burns. Second-degree burns covering large areas, third-degree burns, and even fourth-degree burns. These go deeper into the skin, damage tissue and nerves, and can be life-threatening. They may appear charred, white, leathery, or numb. If you ever see these signs, do not try to handle it yourself. You need to call 911 or get to an emergency room immediately. Here's a quick way to remember. Small red, surface-level burns. Usually safe to treat at home. Large, deep, blistered, or blackened burns. That's a hospital trip, no question. Another important point: even if the burn seems small, if it's on sensitive areas like your face, hands, feet, or genitals, or if it wraps around a joint, you should still see a medical professional. Burns in these areas can cause lasting problems if they don't heal correctly. And if you have certain health conditions like diabetes, poor circulation, or a weakened immune system, you should also be more cautious and consult a doctor even for what looks like a minor burn. Your body might have a harder time healing, and infections can set in faster. So why is quick and proper treatment so important? Because a burn injury is not just about pain. It's about what's happening underneath the skin. When something hot touches your skin, it instantly damages your skin cells. The heat continues to spread into the tissue even after the source is removed. That's why, even if you've already moved your hand away from that hot pan, the damage can keep getting worse for minutes afterward. This is called progressive tissue damage, and it's exactly why immediate first aid is critical. Treating a burn right away can stop the burning process and limit how much tissue is damaged, reduce swelling and inflammation, minimize pain and discomfort, lower the risk of infection, help the skin heal faster and with less scarring. Unfortunately, a lot of people still believe in old burn myths that can actually make the injury worse. Maybe you've heard someone say, "Put butter on it," or "Use toothpaste, it cools it down," or even "Cover it with ice right away." Let's set the record straight. Butter might trap heat inside the skin and increase the risk of infection. Toothpaste can irritate the skin and also introduce bacteria. Ice is too cold and can damage the tissue even more. So, if you remember nothing else from this video, remember this. Cool water is your best friend in those first few minutes after a burn. Not ice, not butter, not toothpaste. Another thing people often get wrong is waiting too long to treat a burn. They think, it's small, it'll be fine. But the truth is, the sooner you start treatment, the better your outcome will be. Even waiting 10 or 15 minutes before cooling the burn can mean more damage, more pain, and a longer recovery. Here's what we're going to do in this video. First, I'll walk you through the essential first aid step that you should do right away, every single time you get a minor burn. Then, we'll explore 5 natural remedies, things like honey, aloe vera, and other surprising household items that can help your skin recover quickly and comfortably. And finally, I'll share some tips on long-term skincare after a burn, so you can reduce your chances of scarring and keep your skin healthy. By the end of this video, you'll have a complete step-by-step plan for handling minor burns safely and effectively. And you'll know exactly when it's time to head to the doctor instead. So grab a notebook if you like, because we're going to cover a lot of helpful tips that you can start using today. And remember, these aren't just tips for you. They're for your whole family. Kids, grandkids, friends, neighbors. Anyone can get a burn at any time, and you'll be the one who knows exactly what to do. Alright, let's get started with the very first step after a burn. Cooling and immediate first aid. Immediate first aid for minor burns. What to do in the first few minutes. When it comes to burns, whether they happen in the kitchen while cooking, in the garden while working, or simply from accidentally touching a hot surface, the first few minutes are critical. Acting quickly and correctly can make the difference between a burn that heals smoothly and one that becomes painful, infected, or leaves a lasting scar. In this part, we'll go step by step through exactly what you should do right after a minor burn occurs. These are safe, practical actions you can take at home that work for most mild burns, and they're especially important for older adults, whose skin can be thinner and more sensitive. Step 1. Remove the source of heat immediately. It might sound obvious, but in the moment people often panic or freeze. If your hand is on a hot pan, your sleeve is touching a candle flame, or your skin is exposed to steam, move away from the heat right away. Even an extra second of contact can make the burn worse. If the burn comes from hot liquid or grease, be extra careful. These can cling to the skin and keep burning. Gently remove any soaked clothing or jewelry near the burn area. Rings, bracelets, and watches can trap heat and cause further damage, plus swelling may make them harder to remove later. Step 2. Cool the burn, but not with ice. This is one of the most important steps, and also one of the most misunderstood. You should cool the burn with cool or lukewarm running water for about 10 to 20 minutes. This helps stop the heat from continuing to damage the deeper layers of your skin. Why not ice? Ice or extremely cold water might seem like a quick way to cool down, but it can actually cause more damage to the skin and reduce blood flow, which slows healing. Instead, think of gentle cooling like turning down the heat, not shocking the skin. If running water isn't available, use a clean, cool wet cloth. Keep it damp, not dripping, and change it if it warms up. Step 3. Clean the area gently. After cooling the burn, you'll want to make sure the area is clean to prevent infection. Use mild soap and lukewarm water. Avoid scrubbing. Just gently pat or let the water run over the area. Do not use alcohol, hydrogen peroxide, or harsh antiseptics directly on the burn. These can irritate the skin and slow healing. If there's any dirt or debris, remove it gently with clean hands or tweezers. Remember, minor burns usually don't bleed, but the skin is still vulnerable. Step 4. Protect the burn. Once clean, the burn should be covered with a sterile, non-stick dressing or clean cloth. This helps protect it from infection, reduces pain from air exposure, and prevents friction from clothing. Avoid cotton balls or materials that might stick to the wound. If you use a bandage, wrap it loosely so it doesn't put pressure on the burned skin. Some people like to apply an aloe vera gel or a burn-specific ointment at this stage. Aloe vera has cooling and soothing properties, while certain over-the-counter burn creams can provide a protective layer. Just make sure whatever you apply is designed for burns and doesn't contain irritants. Step 5. Manage pain safely. Even a small burn can hurt a lot. For most mild burns, over-the-counter pain relievers like acetaminophen, Tylenol, or ibuprofen, Advil, can help reduce discomfort and inflammation. Always follow the dosage instructions on the package, and be mindful if you have medical conditions or are on other medications. If you prefer natural remedies, applying aloe vera gel or a cool chamomile compress can provide some relief. But remember, natural doesn't always mean better. If you notice irritation or worsening redness, stop using it. Step 6. Watch for signs of trouble. Even if a burn seems small, it's important to keep an eye on it over the next few days. Signs you should seek medical attention include increasing redness or swelling, pus or unusual discharge, fever or feeling unwell, severe or worsening pain. If the burn is larger than 3 inches, covers a joint, or is on the face, hands, feet, or genitals, it's best to get it checked by a doctor, even if it looks minor. These areas are more sensitive and prone to complications. A word for older adults. If you're over 65, healing can take longer, and the risk of infection is higher. That means the steps above, cooling quickly, cleaning gently, and protecting the burn, are even more important. Also, check your tetanus vaccination status, because burn injuries can be a gateway for bacteria. The bottom line for first aid. When you experience a minor burn, think cool, clean, cover. Cool the burn with lukewarm running water for 10 to 20 minutes. Clean gently with mild soap and water. Cover with a sterile dressing. These simple actions can help your skin heal faster, reduce pain, and minimize scarring, allowing you to recover safely at home without unnecessary complications. Step-by-step home treatment for minor burns. When you or a loved one experiences a minor burn, what you do in the first few minutes can make a huge difference in how quickly it heals and whether it leaves a scar. The good news is, with the right approach, you can manage a small burn safely at home, without panic, without unnecessary pain, and without causing more damage. In this section, we'll walk through a step-by-step method for treating minor burns using safe, reliable home practices. I'll also share some common mistakes people make and how to avoid them. Step 1. Stop the burning process immediately. The very first thing you must do after a burn injury is remove the source of heat. Even if you've already pulled your hand away from a hot pan or spilled coffee, residual heat can continue to damage skin for several seconds. Here's what to do. Move away from the heat source. Turn off the stove, unplug the iron, or set down the hot object. Remove tight clothing or jewelry near the burned area before swelling begins. Rings, bracelets, or even watches can restrict blood flow and cause further injury. If your clothing is on fire, stop, drop, and roll. Never run, as running can feed the flames with oxygen. Remember, seconds matter. The faster you act, the less damage your skin will suffer. Step 2. Cool the burn, but do it the right way. One of the most important parts of treating a minor burn is cooling the affected skin. But how you do it makes all the difference. Run cool, not cold. Tap water over the burn for 10 to 20 minutes. This helps draw heat out of the skin, reduces pain, and prevents deeper tissue damage. Avoid ice or ice water. Extreme cold can harm the skin and slow healing. If running water isn't available, you can use a clean, cool compress. Wet a soft cloth or gauze in cool water and gently place it over the burn. Re-wet as needed to keep it cool. Cooling the burn also helps calm the nerve endings, which is why you often feel immediate relief after rinsing under cool water. Step 3. Clean the burn gently. Once the burn has cooled and the pain is reduced, you'll need to clean it to prevent infection. But be gentle. Burned skin is fragile. Use mild soap and lukewarm water. Avoid scrubbing or rubbing. Pat dry with a clean towel. Do not rub. Never break blisters if they form. Blisters are your body's natural bandage, protecting the new skin underneath. At this stage, your focus should be on removing dirt and bacteria without irritating the skin further. Step 4. Apply a soothing protective layer. After cleaning, you'll want to create a gentle barrier to protect the burn and promote healing. You can use aloe vera gel, known for its cooling and anti-inflammatory properties. Use pure aloe vera from a plant or store-bought gel without added alcohol or dyes. Over-the-counter burn ointment. Products containing ingredients like lidocaine or benzocaine can help with pain relief. Honey. In some studies, medical-grade honey has been shown to have antibacterial and healing properties. If you use honey, make sure it's clean and from a trusted source. Spread a thin layer over the burn. Too much can trap heat or cause discomfort. Step 5. Cover the burn properly. You might think leaving a burn uncovered will help it breathe, but in most cases, keeping it protected helps it heal faster and lowers the risk of infection. Use a sterile, non-stick bandage or gauze. Avoid materials that can shed fibers into the wound. Wrap loosely. You don't want to put pressure on the burned skin. Change the dressing at least once a day, or whenever it gets wet or dirty. By covering the burn, you shield it from dirt, friction, and accidental bumps, all of which can cause pain and slow the healing process. Step 6. Manage pain and inflammation. Pain from a minor burn can last hours or even a few days, depending on severity. Over-the-counter pain relievers can make the healing period more comfortable. Acetaminophen, Tylenol. Good for pain relief without reducing inflammation. Ibuprofen, Advil, Motrin. Helps with both pain and inflammation. Always follow the recommended dosage, and check with your doctor if you have other medical conditions or take prescription medications. Staying hydrated and getting enough rest also helps your body recover faster. Step 7. Watch for signs of infection. Most minor burns heal without complications, but infection is still a risk, especially for older adults or those with weaker immune systems. Seek medical attention if you notice increased redness or swelling after the first couple of days, pus or unusual discharge from the burn, worsening pain instead of gradual improvement, fever or chills. Early treatment of infection can prevent more serious health problems. Step 8. Support the healing process. Once the initial pain is gone, your skin still needs time to fully repair. You can help speed up recovery by keeping the area moisturized. Dry skin can crack and reopen the wound. Avoiding direct sunlight on the burn, as healing skin is more sensitive to UV damage. Not scratching if it becomes itchy. Scratching can damage new skin and cause scarring. Healing times vary, but most minor burns improve noticeably within a week and heal completely in 2 to 3 weeks. Common mistakes to avoid. Even with the best intentions, many people make errors when treating burns. Here are some things you should never do. Don't apply butter, oil, or toothpaste. They can trap heat and increase the risk of infection. Don't use ice directly on a burn. Don't pop blisters. This exposes raw skin to bacteria. Don't ignore larger burns. If the burn is bigger than your palm, see a doctor, even if it seems minor. When to seek professional help immediately. While home treatment works well for first-degree burns and small second-degree burns, you should get medical care right away if the burn is on the face, hands, feet, or genitals, covers a large area, the skin is white, charred, or numb, possible third-degree burn. The burn was caused by chemicals or electricity. In these cases, professional treatment is essential to prevent long-term damage. Thank you for taking the time to listen and learn. Your health and safety matter, and every small action you take in those first few minutes after a burn can make a big difference. I hope these steps help you feel more confident and prepared. Stay safe, take care of yourself, and remember, a little knowledge today can protect you tomorrow. Do you want me to also make a shorter, punchier YouTube-style outro so it feels more engaging for viewers? That would make it flow better at the end of your video.